set up. Hey, Jefferson and Naomi. We're going to be starting in about 4 minutes. Myself. Hi, Naomi. We're going to start in about 4 minutes, okay? I'm just waiting for our folks to show up here. Okay, I'm going to mute myself.
Hello.
Hey, we've got about 3 minutes. How are you doing, Amanda?
Good.
Good.
I will share my screen here in a second.
Okay. I already have it set to record. Okay. Cool. I'll be right back.
Did you ever get me on?
Sorry.
Hey, Kevin.
Hi. I also have
Hi, Mandy. It's Donna.
Donna's hiding in the shadows over here. So we got 1 more minute. Oh, we're at 12:30. So we can give people a couple more minutes. I think we've got 7 people on here so far. Put this over here. Get started. All right. We'll get started since we've got people that are on time. And so my name's Kevin Hamlet. I'm the Human Resources Director for Sound Valley Medicine. This is our regular SFM health webinar to be able to answer questions that you have about our health plan, the sound plan that we introduced back in April of this year in 2021. as well as to introduce topics or questions and things that we've received or in talking with our friends at Adapt that you may find relevant. And one of the opportunities we wanted to take this time is we've had a lot of new people come on board, and so we want to make sure we're answering questions about the plan and what it can do for you and how it works, because it is different than what a traditional fully insured plan would be. So with that, Donna, I want to introduce some folks from outside from Adapt Benefits that will be guiding us in this first part of the conversation, and we'll open it up for questions. And that's with Amanda Roney from Adapt. She's our special guest that helps us in presenting these topics and helping us with these questions. And Sarah Tarp is also part of that team to act as backup as well. So with that, I'll turn the time over to Amanda and we'll go from there.
Yeah, thank you. Yeah, so we're going to take some time to just do an introduction to the plan for those of you who are new and a refresher for those of you who aren't so new. So what I have on the screen should look a little bit familiar. It's from the benefit guide that we produce every year. That is a really compiled place to find all of your benefit information. So that'd be everything from what we'll kind of focus on today, which is the medical and pharmacy, but also other benefits, your ancillary benefits, any life or disability, vision, dental, that kind of thing. So it has a really great progression as it works through all of your benefits and talks through the detail for each of them. We're going to focus a little bit on the medical and pharmacy today, but this page in your benefit guide serves as a good visual and demonstration of how we design the plan and what's a little bit different about the sound plan. So the sound plan was designed to be very tailored to Sound Family Medicine members themselves and their families. So the way we did that was try to have the best of both worlds. So there's some cases where we use networks, so large national networks that have more providers. So what you would traditionally see in a plan like a Regions network or a Providence network or things like that. So you would have big lists of tons and tons of providers to be able to see. We like to utilize that so that you can have access to care with providers really easily, and a big range of providers that you can go see that are good costs for the plan, so we can keep the cost to you low. We also try to combine that with what we call direct contracts. So the Sound plan themselves and Sound Family Medicine as an organization is a provider organization. So we're a provider organization, and we also have employees that are seeking benefits or patients themselves. So as a provider organization, the Sound Family Medicine organization has connections, obviously, in other provider organizations. Let me see if I can mute. I don't think I can, but be sure to mute your audio if we're getting some feedback back and forth. But as a provider organization ourselves, the Sound Family Medicine team has connections to other providers in the community. So what we said is, how can we as an organization connect with our current connections and try to keep the cost of care low? So that's what a direct contract is. It's the Sound plan themselves reaching out to providers that are in your community and saying, let's cut out the middle guy, the insurance middle guy. Let's just make a contract between us for our employees and you. And those direct contracts are one of the ways we really try to drive the cost of care down. Because when we cut out some of that, the middle contractual requirements of networks where, the provider systems have to agree to big contracts, they have to treat every, patient that comes to see them the same, every patient is cost the same. When we cut out that kind of middleman, we're able to get really preferential contracts based on those relationships. And that's what it is. It's a relationship between the Sound Family Medicine plan, between you as an organization and all the employees and your families that work with them, and those providers that are in your community that we're contracting with. So we have different kind of paths. So we talk a lot about the plan pathway in the benefit guide. So the plan pathway is just a way to visualize how we hope that you consider using the plan as it's in the best case scenario. So the best path will be, going from tier 1 all the way through. When you see a traditional plan, you have like different tiers of benefits, in network, out of network, as an example of a 2-tier plan. So the plan for the Sound Family Medicine organization has 4 tiers. So plan tier 1 is the best path. That are those direct contracts. And it's totally a domestic contract. So it's just Sound Family Medicine organization itself. So going to your own facilities, your own providers, that is 100% the best. And by I say best, it's not only the most cost effective, obviously, for Sound Family Medicine, but as an extension of that, it's the best for you as a member because that's where the lowest cost share is. So going in that tier 1 is going to be the best cost share. Better path is the next step over. That's the Sound Family Medicine plan, making those connections in the community, those direct contracts where we've contracted, for instance, with CHI Franciscan Hospital System and said, we're going to have a direct contract, just Sound Family Medicine employees and their families, and you, CHI Franciscan. And because of the nature of that contract and the advantageous pricing that we were able to get for it, that's going to be the second best, the better path. Then we have other paths to say, well, let's just say I can't go to a Sound Family Medicine provider. Some of those direct contracts, I mean, clearly we're making those individual connections. So we don't have every single person you look at when you look in your community. We haven't contracted with everyone. What if I can't find someone in those 2 tiers? Then we have good paths. So we have other RAP networks, things like PNOAE network, lots of letters, and we'll explain what that is, and the PHCS network. Those are big sets of provider groups where you have access to primary care that way. If you say, I can't find anyone in either of those 3 tiers, that doesn't necessarily mean that you're out of luck. So one of the other unique features of the Sound plan is that we have the opportunity, because we've taken apart those pieces of a traditional plan, we have the opportunity to use some of our vendors, namely Advanta and HMA. HMA is our administrator, third-party administrator for the plan, and they have an entire team of advocates that reach out on your behalf and can do what we call single case agreements. So let's just say you have, a hospital stay, or maybe you find a primary physical therapy provider that's not in any of the other tiers, but it's in your neighborhood. You have great feedback from your cousin, uncle, whoever that has been to see them. You think you're going to get great high quality care there, but it's unfortunately, we don't have a contract with them yet. Advanta, their team will reach out on your behalf and put in what we call a single case agreement, an agreement that's just a small version of a contract that says, hey, physical therapy provider, what can we agree to in terms of cost of care in advance for this member? How can we get this member seen? Let's agree to a cost in advance. And then that will allow you to have a preferential cost share. So they will do that on your behalf. Those advocates reach out and can make that happen for you if it's possible, if the provider is willing to do it. And they can also help if you get in a point where you've tried all 3 of the tiers, you think the provider might be able to contract with you, or they've just said, heck no, but what do I still want to see them. I don't want to contract, but I still want to see them. Advanta will help you figure out what to do next. So working your way through those pathways and kind of understanding what's different about us is a good place to start, because we want everyone to sort of understand the flow and how to kind of drive your cost share, if you can, as close to that best path and better path as possible. So this is all in your benefits guide to read through if you want a little bit more detail in it. This is a little flyer about Advanta. So they talk through what we call balance billing. So if you've been in a traditional plan, you go to an out-of-network provider, you have a cost share that might be like deductible, co-insurance. You might pay that deductible co-insurance, but the provider could still say, well, that isn't enough. What your insurance company said is the allowed amount. We've decided is not enough based on our costs. So we're going to actually bill you, member, the extra. That's called a balance bill. If you receive a balance bill, unlike a Cigna, a Regents, where you're just on your own, sorry, so sorry, you got a balance bill, you're just going to have to pay it, I guess. The Advanta team instead has what they call a post team that specifically reaches out and helps negotiate those balance bills for you, helps you go through the process of figuring out what your additional costs would be. And, in some cases can negotiate that down completely or at least significantly lower on your behalf. So they don't just leave you to your own devices. If you can't find anyone in the network, but you're just adamant that you really need to see this provider or really need to go to that facility, they're still there to help you with that. And that's one of the big benefits to using HMA, which again, that's our third-party administrator on your ID card. Their Advanta team are those advocates that do all of that work on your behalf. Okay, let me escape out of this and talk a little bit more about those tiers. I'll share this guy because the color coding sometimes helps. Hopefully everyone can see that. This is just a review of what we just talked about, those different tiers as you look at your plan design. So in your benefit guide, you see these same tiers. The tier 1, sound family medicine facilities and providers. We made this green for go, like green light. This is the easiest place to get care. But as we know, you don't necessarily treat everything, don't have every specialist in-house. So there are some times where you have to go out of the sound family medicine providers. Tier 2 are those direct contracts for providers and facilities. We have direct contracts all over the Seattle area. We have some that are nationwide. It's everything from durable medical equipment like CPAP machines to hospital like CHI Franciscan in that hospital system. It's a slightly higher cost share, but really, really still low cost care for you in those direct contracts because we can, take advantage of those opportunities in those relationships that we have to have really advantageous pricing. So it's not just advantageous pricing to sound family medicine, it's passed on to members in exchange for using those providers. Tier 3, PHCS and the PNOAE networks, those are large nationwide provider networks. So that's where we find office visits with specialists and just traditional primary care, as well as ancillary, which ancillary is things like labs, imaging. So those kind of providers, they have a very easy search to use in your HMA portal. So when you get your ID card, you can go onto the HMA website, set up your portal using your ID number, and your search, you'll be able to search those networks really easily and quickly and in a streamlined way. We have also another network ability for you to search with those direct contract tiers. So we use a company called Health to Business. They help us do that contracting. So once we have a relationship with the provider, a bunch of paperwork that we need to get done with them and develop that preset pricing, Health to Business facilitates that. And they also put together an online web-based search, a network search, so that you can search those as well. If you don't have access to that search, let human resources know and they can send that to you. It's a little flyer, and it also has a way for you to nominate providers. So if you don't see someone in the direct contract here and you think, shoot, I mean, right now I'm seeing this person and it's tier 3 or tier 4, but it'd be nice, and I think other sound family medicine members would use it too. If we were to be able to get a direct contract with them, you can really easily nominate providers, and they use those nominations to do the outreach. It's really helpful to have that nomination because if they have a true member that says, hey, this is a current patient or current customer of yours, they nominated you, they would continue to use you if you were in that lower tier. That speaks a lot to some of those, privately held facilities and practices. So we love to have provider nominations in tier 2. Kind of drives a lot of our ambitions in reaching out to providers. And then tier 4, this is technically what we call out of network. It doesn't necessarily mean that you are left again on your own. So even though you might have out of network where we're just subject to what the member does or what the provider decides to charge, the plan is still paying what we call a usual and customary, which is a Medicare percentage. So we pay 200%, up to 200% of Medicare. If that's not enough, and the provider says, nope, we think you should pay more than that, you have a balance bill, you're not on your own with that. So please do reach out to Advanta, have them assist you in negotiating that, see if there's anything can be done to get that lowered. We don't want you to be in a scenario where you just think, I'm just out of luck. There's no one to help me with it. Or even worse, try to take on that burden of customer service and calling and trying to talk to someone and get to the right person. That's what Advanta does all day long. So that's what their team is designed to do to help you in that. So this is the worst, but it still isn't a bad option. You still have resources to help you if you're in that out of network tier. That was a lot of information. So I want to give an opportunity for people to ask questions and to see if there's any areas where we can go into a little bit more detail. If Kevin, if you think it'd be appropriate, we could go into a little more detail of the individual plan design if you wanted to, but I also just want to give people an opportunity to ask questions if there were parts of that where you just thought, shoot, that doesn't make a lot of sense. What is she saying there?
Unmute myself. Yeah, I think there's a lot of information here. So at this point, let's open it up to everybody that's on here. Some of you are in groups watching this together. You're welcome to use the chat, or if you want to unmute yourself, we can go that route and take questions either way. And yeah, there's lots of good questions. I know Donna's had some questions too, so if I don't get any here in the short term, well, I'm sure we'll have some.
No question for me.
Go, Jefferson.
I said no questions.
Oh, no questions for you. Okay.
I will point out that you don't have to, if you have a question that's more specific to you and a claims issue, or a question about a particular condition, you're not sure how to be covered or how you could find a provider for it, don't feel like this is necessarily where you would have to ask that question. You can also send that in a private space, and we can respond in a more HIPAA compliant way too.
Yeah. You reach out to Donna or I directly, or you can reach out to Adapt directly as well. So.
If you're thinking, how would I reach out for those questions? In that same benefit guide that we talked about, there is also our contact information, and I can page where it is, I'll tell you. It's on page 17 in that guide. It's a big table of all of your contacts, phone numbers, websites, and it has our information as well. We're Adept Benefits Advocacy, has Sarah's information there, but she also has a pretty direct line to myself and other team members. So that would be a great place to kind of start to ask questions if you don't want to go through Kevin and Donna. Somebody asked a question about, do you need a referral to a different PCP other than SFM providers? No, your plan doesn't have a referral requirement unless the provider themselves has a referral requirement. So there are some cases where, even in the case of specialty care, where the plan doesn't require a referral for a specialist, but your specialist might, just based on the, their scheduling. Maybe they have a long wait time and they want to be sure they're getting a referral for all the members they're seeing, that seeing that specialist, the care is appropriate. So no, there's no requirement for a referral.
Good question.
To see what plan you chose last year, you could either ask Human Resources to see which one you picked, or you could look in your enrollment system. And we don't have access to your enrollment system, I don't think, Kevin, right?
So our enrollment system is the same as our HR payroll system. So if you go into Paycom onto your app, you can look and see what you enrolled in previous years, or you can contact Donna or myself and we can give you that information as well.
You could also call HMA. I mean, they'll obviously know what plan you're enrolled in, but that might be a little bit longer way to get the answer. So it might be a little bit faster for you if you did it the other way.
Well, and Kim, are you looking to find out what plan you chose prior to us going with this new plan, or are you stating what you selected earlier this year for this plan? In a message. So Kim, okay, so in Paycom, okay.
Someone asked a question about, are there any stipulations for pre-existing conditions such as diabetes or I don't know what HTN is, but there are no stipulations for pre-existing conditions.
Hypertension. It was hypertension, sorry.
That's okay. So actually with the onset of healthcare reform, we're no longer, their plans aren't allowed to have pre-existing condition exclusions if they're medical plans. So there are some dental and vision plans that have pre-existing exclusions, disability plans have pre-existing exclusions where they might not necessarily exclude it altogether in the case of like dental or vision, but they might require you have a waiting period before you were able to get it. Some plans have that, not in the case of medical. So there's no pre-existing exclusions for those things.
Thank you.
Thank you for the question. Donna, do you want to ask
Oh, sure.
questions?
I have a question regarding hospital stays. So if a participant is in a hospital, a Franciscan hospital, which is a facility that we have contracted with, and then while in the hospital is seen by a provider, is the provider that is treating them also covered, or is there to be expected to have separate out-of-network provider charges?
So it would depend on the provider that's being seen. Most of the providers in the CHI system, we actually have a provider roster that we get from them on a regular basis, where those providers that are employed by CHI Franciscan are also billing under that tax ID number under the hospital. And
Okay,
they're all covered under that contract. We have a contract with not just the provider itself, but also the hospital system. So we have kind of the facility side and the professional side covered for CHI Franciscan. There are some cases where you go into a hospital, actually any hospital, where they might use contracted groups of providers. And it happens a ton in the emergency rooms, even though in the emergency room, you think you're seeing a provider that's employed by the hospital. It's really, really common that those are actually contractor providers that work for a completely different company. It also happens a lot in anesthesiology. In those cases, they would not be under the contract and they would fall into that higher cost share. We would still do what we can to try to create those single case agreements, reach out and try to negotiate the costs on your behalf. Advanta does that for you, but it would fall in the higher cost share because we have no contract with them. We can't control the costs.
okay, thank you.
Any other questions? And I can't remember if you said this earlier or not, Amanda, but once you make a selection, either due to being a new employee through that period of enrollment that you're eligible to enroll, or you made a selection because you were already an existing employee and did it in open enrollment, once you make that selection, you're in there for the plan year, which our plan year is April 1 through March 31. So our plan year for this particular plan year will end in March of 2022. Open enrollment will begin probably the end of February, early March for the following plan year, which will begin April 1st of 2022 through 2023. So if you just got hired recently and you're trying out one version of it and you want to make a different selection, or you made a selection earlier in the year, you need to wait until that open enrollment period to make a modification.
Yes, the IRS, in order to offer the tax incentive of being able to pay for your benefits on a pre basis, the IRS requires that there's a limit into the changes that you can make. So the IRS requires that if you're going to make a mid-year change, you have to have a qualifying life event. So that's big stuff like marriage, divorce, maybe a change in coverage opportunity. If your spouse has an open enrollment event, that would open up a change for you, for example. But it's very specific reasons that you can make mid-year changes that's governed by the IRS, by those rules because of the pre-tax status. So we are getting ready to have open enrollment in the next few months. One thing to point out is that even though our plan year is April 1 through the end of March, our deductibles, co-insurances, out-of-pocket maximums, all those run on a calendar year basis. So your deductible will start again in January.
That's not correct.
Oh, that's not, you guys have a plan year plan?
Mm-hmm.
Okay. So thank you for correcting me on that.
Yeah.
So what Kevin is saying is we have traditionally plans that run through a calendar year basis. We have deductibles and everything that resets. He's saying your plan actually has that plan year timeline. So your deductible starts April 1st, and then the following March 31st, it would end. So you'd restart that accumulation or those kind of buckets for deductible and out-of-pocket maximum on that March or that April 1st day every year.
Yeah.
Question regarding that qualifying life changes events or something like that. Because my family, they're migrating here in the US in the coming, maybe early next year. I don't have the exact date yet, but would that qualify in that category?
Like so anytime that you have someone who lost coverage, group coverage, which if they had coverage under a previous employer or they had coverage through a previous
Mm,
federally sponsored
yeah.
plan or
Mhm.
whatever, they would have access to enroll on your plan as a qualifying life event.
Yeah, it's gonna be their first time being here in the US. So they don't have any social security or any record of being here. So it's basically they're gonna be like brand new immigrants here. They're
That would be
moving
something
here.
Okay, so that'll be something to talk to human resources about offline and see what verification they need to get them enrolled. But
Okay.
newly being newly eligible for coverage is a qualifying life event. So we just need to probably talk with human resources about what verification they would need in order to make sure
Okay.
they're eligible.
All right. Thank you.
Yeah, and I think Jefferson, I think Donna can assist with that if she hasn't already had some conversations with you about that. So
Okay. Thank you, Kevin.
you bet. Goldie, I know you had Naomi, perhaps some others with you. Any questions from where you guys are?
No, I think we're good, Kevin.
Okay. Dana, I just noticed that you joined us some point in this. Any questions from your group? Not hearing any. So unless there's any other questions, if you have any questions at all about what we discussed today, or you come up with questions a half an hour or so after this, you're more than welcome to email us at humanresources@soundvalleymedicine.com, or you can email Donna Van or I directly. And if you look at your benefit guide, it has contact information for Amanda and Sarah as well if you have additional questions from this session. We're also going to publish this on our hub and our intranet or SharePoint site. And so this video will be made available through that via YouTube. And you'll be able to watch that at home or wherever. So, thank you everybody for attending. We're about 2 minutes early, but I think, we don't have any other questions. I think we're okay to end today's session. Thank you so much, Amanda and Sarah, for being part of this today. I wish everybody a happy holidays, and thank you so much.
Thank you, Kevin. Thank you, guys.
Thank you.
Thank you, Kevin.
Thank you.